Good afternoon. I'm Hayden Bush with the AHA's Hospitals in Pursuit of Excellence platform, and I'm here today with Linda Reed, RN, who's the Vice President and Chief Information Officer for Atlantic Health in New Jersey. Linda, why don't you start off by telling us a little bit about Atlantic Health?
Surely. Atlantic Health is one of the largest health systems in New Jersey. We are approximately 1,200 beds. We are about $1 billion in revenue. We have a cardiac surgery program. We have many centers of excellence, cardiology, orthopedics, neurology. We are geographically about 45 minutes west of New York City and pretty much in the middle of the state of New Jersey, northwest. Okay.
And I understand that you had a project underway where you really wanted to link your physicians with your EHR. Can you tell us a little bit about that?
We did. Like everyone else, probably around 4 years ago, the stark relaxation laws came through, and we had looked very closely at what we would do from a subsidy perspective for our physicians. In New Jersey, it's very interesting because a lot of our physician practices are not large; they're small. And the more we talked to physicians about what kind of electronic health records they would want in their offices or could support, it became very clear to us that many of them were not in any way automated. Many of them had no computer systems. Many of them didn't even have internet access in their office. Knowing how difficult electronic health records are to implement and to make work, we just wanted to do something that we would be sure that wouldn't introduce a lot of chaos into their offices. Physicians just can't bear that from a revenue perspective, and they have very little tolerance for something that takes a lot of time on their part. So we took a look at that, and we figured very quickly that we probably wouldn't be successful trying to introduce an EMR right off the bat. The physicians didn't know which ones they wanted to use. If we suggested one, they would want something else. So it was a difficult conversation. So we started looking for some alternatives. How could we help physicians automate their offices without maybe inserting an electronic medical record right now when they weren't ready for that? So we looked around for different products, and we did find something that we thought would help as a transition platform. And that provided us with EMR-like components. It allowed physicians to communicate securely through email with patients and other physicians. It had e-prescribing. It had online appointment requests, renewals for medications for patients. And so it really allowed us to put something in that was less rigorous than an electronic medical record, but still provided them with automation features that would let them gradually, work themselves into automation.
Mm-hmm. And what was their response? How did they accept the new system?
It was interesting because I think the way that we did it, it was modular. So physicians could kind of bring up the things that they liked up front and then add on to them. Most physicians loved bringing on some of the communication tools, mm-hmm. and that was one of the first things they brought up. And then gradually they started bringing up the e-prescribing. And what has happened since is that they are very, very happy with the e-prescribing, and some of them that we thought would never, ever do e-prescribing do it now. And they love it because the automatic renewals for the medication renewals for their patients now come in a minute. They can have those renewals done, mm-hmm. and sent to the pharmacy, and it's good for them, it saves them time, and they think it's great for their patients.
So they've really kind of accepted it and championed it kind of in their units.
They have. Not everyone, not all physicians are still, buying the fact that they're going to have to automate in some way, shape, or form. So some of them won't use it. I think more physicians are more concerned about what's going to happen with email, mm-hmm. and what happens when they strike up email conversations with their patients. Mm-hmm. But we're seeing that more and more patients are starting to expect that. Mm-hmm. So I think it's one of those challenges where physicians are going to have to look at their workflow, mm-hmm. and how do they change that to start meeting patient needs in those areas.
So you're really starting to see the patients buy into the system as well?
Oh, absolutely. One of the things with this system that we put in is that it came with a personal health record, okay. for patients. And the patients really love it. We can actually download results right into that. And we have it so that the physician looks at the results first and then checks off the ones that they want to send down to the patient record. we now have about 29,000 patients that are signed up for this, and they love it because they can communicate with the physician. They can do the appointment requests online whenever they'd like, and then most of them really love the renewal aspect. So if they need a prescription renewal, they just put the renewal into the system, and then it gets automatically renewed. They get a message, and they go right to the pharmacy and pick up their medications. So we had a phenomenal response from patients.
So it sounds like you've really introduced some ease into their interaction that they may not have had before.
We have, and patients that are, especially, they're starting to get on email a lot, and patients are searching the web for healthcare information. And this is just one more way to connect them via the internet to their healthcare. And I've gotten lots of emails from patients because we have a feedback button that just said that this is one of the best things that we've done for the community.
And I also wanted to ask you about your health information exchange. I understand that Atlantic is very engaged in those efforts, and just wanted to get a sense of how that kind of came apart.
Well, it's one of those things like a funny thing happened on the way too. So by putting in the system that we put in for the our EMR, that kind of grew into a virtual information exchange, and we've been using it to exchange information with some of our affiliated physicians, data exchange right into their electronic medical records. So when we started doing that, and there was a couple of other hospitals in the area that used the product also, and we could, since it's a software as a service, we're all connected up on the same platform. So we chatted, and we saw that we could exchange data very easily. Then we also saw that what was coming down the pike with meaningful use and data exchange. And one of the things we were able to do is we were able to bring together 10 hospitals in north central New Jersey. This platform that we use is going to be the key to that. That's the technology we'll be using to bring all 10 hospitals together so we can start exchanging data and start pushing data out to all of our physicians. And that really takes into account a huge part of the state. What we were able to then do when we formed this collaborative is apply to the state for a grant from the ONC. The state of New Jersey selected us as one of the 4 supported health information exchanges, and so we were awarded $3.5 million.
And were there any difficulties just in terms of working with your competitors on this?
It is, and that's very interesting. I think one of the really interesting things is that all of the CIOs in our collaborative, we've known each other for a very long time. So there is some trust there, not that we don't compete. So we've known each other for a long time. The competition aspect is really very interesting because we all compete on procedures. The fact that a health information exchange is something that we're looking at is kind of scary in a little way because it could impact your business. If you're sharing data and you're sharing results, all the money that you've put into technology that was potentially your competitive advantage gets kind of equalized out. So if you're sharing data, if you don't have this technology, you can always pick up the result from someone else. It takes away a little bit of that competitive advantage. So you have to start looking at how you're going to compete in different ways. But so we do have to always be cognizant of the fact that there are some competitive stressors, but it's the right thing to do for the patient and for patient care. And if we're going to get into the meaningful use arena, being able to exchange data is very important too.
And just as a final question, I'm just interested in terms of how you would give advice to a hospital or a health system that was just beginning to go down the path of meaningful use in terms of what they really need to be looking out for.
Oh, for meaningful use, I guess the thing I'd be looking at is where are you in your readiness right now? When you take a look at what the was 23, I think now is 10 or 14 plus objectives, can you meet them? And when can you meet them? Is your vendor ready to be certified? If they're not certified, when will they be ready? Because I think one of the things you're going to be looking at is, are you going to be looking to capitalize on the incentives, or can you not afford that, and are you going to really just be looking to be ready before you have to pay any penalties? So I think it's really important to have that gap analysis done so that you know exactly what you're shooting for. And then you have to take a look at data exchange. Are you going to join an HIE in your state? Is there one that already exists? Is data exchange with your physicians enough? So it's really looking at those regulations and keeping an eye on what those objectives and those definitions are. CHIME, the American Hospital Association, are all great resources for understanding how those rules are going to shape up.
Okay. Well, Linda, thank you so much for joining us today.
Thank you.